My name's Janelle and I was diagnosed with type 1 diabetes when I was 10, and there are numerous complications from diabetes. One of them is blindness, which I managed to achieve by the age of 29. Another one is nerve damage, that's to both internally and peripherally, and I've got varying degrees of nerve damage. And one of the other major problems is kidney failure and kidney damage, and I managed to have my kidneys totally fail by the age of 39. I was really lucky that the doctor I was first sent to when I went to the public hospital to go to the renal clinic, when they suddenly realised I was extremely anemic and the reason was my kidneys were failing, that the doctor I went to is a really big advocate for transplantation. And because I wouldn't have been very likely to get on the kidney alone transplant list, he put me straight away onto the pancreas kidney transplant list, and 7 years later I finally got my transplant. It's a lot harder to get on the kidney pancreas transplant list because there is so many extra criteria. I had to be under the age of 40 to get on. I needed to be in otherwise very good health. I had to have a really positive attitude, that they knew that by going through this very large operation and by donating me 2 organs, that I was going to do something with my life afterwards. That I wasn't just going to say, great, I've got a life now, but I'm just going to sit at home and make sure they don't fail. They wanted to know that afterwards I was going to do something with my life. And it didn't necessarily have to be go and be a superstar pop singer or something, but it needed at least to be that they knew you wanted this transplant to go and achieve something. I actually got the call twice. The first time I flew all the way down to Sydney in an absolute panic, and got there to find out that because of some complication with the donor, that I wasn't going to get that actual transplant. And that was a 2:30 a.m. call, and the next time it was a 4:30 a.m. call. I'd been waiting on the top of the list, on the active waiting list, for 6 months. So first of all, I'd had my bag to just grab and run, packed for summer, and then as it's getting into autumn, I'm changing clothes a bit, and by the time it was winter, I had to repack again.
When you had that false alarm, did you have mixed feelings, partly relief, oh God, this isn't it, or was it absolute disappointment?
No, because I knew that this could happen. I knew a few people they'd got the call 3 times before it was finally the one, and they were ready to give up. So I knew that was a really good possibility that this could happen. And the first time I was so anxious, so nervous, it was like I wasn't ready. And being a performer all my life, to me it was like the dress rehearsal. So when they said, sorry, it's not happening, this one didn't go to you, it was a relief to me. And this tension that I'd just been holding for the last few hours getting down to the hospital in Sydney was just gone from me. So when I got the actual call, I was really calm, because I'd done my dress rehearsal in a way, and maybe my head timing wasn't right for the first one, but the second time I was just ready for it.
Just take us through the operation immediately before, how you felt before going into theatre. Just run us through the whole procedure.
Well, because obviously, like I said, you sort of rush to the hospital, and of course when you're jumping on planes and getting to Sydney and then discovering a taxi driver who doesn't speak a word of English and doesn't know there's such a place as the Westmead Hospital, and then getting to the hospital and racing up, and I didn't need to go into admission, so I get up, they grab me, my poor husband's left just sort of as a bystander, forgotten about, and they're straight away reading me out lots of documentation, they're making me sign things, they're putting cannulas in my arms, they ended up taking 16 tubes of blood, because of course they had to check for everything. It was just a hive of people running around me, asking me questions, getting me to sign forms, taking bloods, checking other things, getting me into the right clothes. And before then they said, okay, we're ready to go, and started pushing me towards the operating theatre.
You obviously went pre-prepared with quite a bit of medical knowledge. Do you think that's an advantage, knowing a bit, or is it best to go in there absolutely cold?
I think it was because I was really prepared for every outcome. Not that I would have been happy with every, but I went in there really, really aware of what I researched everything I could. I talked to every patient I could, and I know a few people who went there just really having no clue, sort of saying, well, have my transplant and then, I'll spend, weeks in Sydney just shopping. And you spent weeks in Sydney recovering and also just having really no clue about the whole, what's going to happen, what can the outcomes be, what, how many tubes and what is your body going to be connected up like afterwards.
Yeah, I've noticed that you have all different levels, different concentrations in your blood. You knew all the statistics. Do you find that's important to be well armed like that, to communicate properly with the nursing staff?
I like to be, because I have found that if you suddenly get a different doctor, a different nurse, and they'll say to you, well, what's this normal level? What medication you're normally on? I always find that being able to rattle it straight off, especially when you suddenly end up in emergency with something, just to be able to say, these are my levels, this is my normal level, so they can look, because a lot of people who've had the kidney transplant, their creatinine level doesn't go back to, let's say, what's considered a normal level, and yet it's their normal level.
You can't take it as granted that your medical records, i.e. your normal levels, will accompany you to the hospital.
No, we haven't introduced the e-health records yet. So until then, if I turn up at any hospital, unless it's my regular hospital, they don't know who I am. So
you'd recommend to people who are following your footsteps that they take records with them?
I have a folder now. I have a folder from Westmead. I have a folder with all my medications in, with all my details about anything that's happened, like the important things. So I can turn up at a hospital and I can just hand them the folder.
And how often do you have to take tablets?
I take tablets 4 times a day. But, from when I first had the transplant, when I was on huge doses of all, especially the immunosuppressions, now I'm a much reduced dose, but of course still, people keep on asking me, so have you been able to stop taking those drugs now? So of course not. I'm being treated for kidney failure. I'm not cured of it. I have a transplant, I have a new organ, but it's still just another treatment. It's a far preferable treatment to dialysis, but it's still a treatment. If I stop taking those drugs, my organs will reject.
Tell us about the role of your husband and your family.
When I was put on the transplant list, part of the deal is that I need to be accompanied by a carer, by someone with me, because when they release you from hospital after a week or however long it takes for you to be well enough to be released, they need to know that someone is there with you should anything go wrong. And obviously in the beginning, I was so weak. It took me, I think, 5 weeks before I was able to get up and start cooking myself a meal. And I know other people recover much quicker, and I know some people who recover much slower. I thought I'd be able to walk up to the hospital within the first week, because every day I was up at the hospital having more blood tests and seeing the doctors just to adjust everything and make sure everything's going fine. And it took me ages before I could walk very far, and I was really, really annoyed that I just thought I'd be better so much quicker. I ended up in Sydney for 7 weeks after the transplant. The norm was about, let's say the medium or whatever is 6 weeks. There's few people who leave after 5 weeks, because obviously they're just still adjusting so many things and checking on so many things, and they also want to do a biopsy after 5 weeks. So the normal is about 6 weeks, but because I had that bit of a hiccup in the beginning with getting the gastro infection and ended up back in hospital for 10 days, I end up there for 7 weeks. But there's other people who'll end up there for months because there's something going wrong. So it's a piece of string, how long you'll be there, but I think the norm was about 6 weeks. Coming home for the first time, I was reacquainted with my house and with my pet birds who I'd left behind, but also was the difference between when I flew to Sydney for my transplant, I was unable to cook. I was unable to stand in the kitchen to cook. I didn't want to eat anyway. I was being force-fed anything because I was so sick I didn't want to eat. And it was the difference. I got home and said, I'm going to cook. And the first thing I did, because we had a house sitter, it was like, I'm going through this fridge because there's all these disgusting things in the fridge. And so I completely cleaned out the fridge and then cleaned all the benches and then started cooking. And I'm thinking, I can't remember the last time I had this much energy. It was just such a dramatic change for me, as suddenly having all this energy, that it had been years. While I was on dialysis, I had decreasing energy levels, and even before that I was pretty sick. So it had been so many years before I had the energy just to get into the kitchen and clean it all out, and like I said, just stand there and cook a meal. I mean, it had been, I think, 12 months before my transplant that I hadn't been able to stand in the kitchen to cook a meal. And since I love cooking, and my husband doesn't enjoy cooking that much, it's great to finally get back into the kitchen. I think being positive is what's pulled me through. I think being positive is what's gotten me through everything prior to getting the transplant. And it's also, I think, what helped me to recover so quickly, because obviously being positive and wanting things to work and wanting things to happen, and not saying no, and not just curling up and saying all too hard. It also has meant that I've pushed myself, maybe sometimes a bit too much, but it means I've pushed myself to get out there and back in and do everything I possibly can. I've always been a positive person, so for me that's just part of me, but I definitely think I can see it in other transplant patients. Obviously you meet a lot of transplant patients when you're going through transplant, and then before and after, and I've noticed that the more positive the people are, the better they seem to handle it. Even if they're getting major hiccups, they seem to just be able to deal with the whole process and any hiccups, and I can't think of anyone who doesn't have hiccups along the way. There was a huge strain with my husband prior to my transplant, because of course he was relied, and he had to do everything for me. He was setting up the dialysis machine for me because I was doing home dialysis every day. He was too scared to leave me alone for very long because I was so sick. He was having to do, of course, all the cleaning and cooking and laundry and shopping and taking me to all the doctor's appointments. He was really worn out by the time I got the transplant cord. He was nearly at his end. Of course, then there's a big adjustment for him afterwards. First of all, he's looking after me as a patient just recovering from a transplant, but then at a certain stage it gets to the point where suddenly I can be so much more independent. So all these things that he actually got used to doing, for instance the cooking, suddenly I'm able to do, and then it's a case of me wanting to even do things like the dishes. I had to fight him to do the dishes because he had just so got into the pattern of he did the dishes, and it was really me having to fight to take back some of the responsibility, but also him so used to having that responsibility and actually, I guess, him feeling needed in such a major way that suddenly I didn't need him as much, and I could see that really affected him really badly. I guess it's like when a child leaves home, that the parents have to let go, that they're just not needed as much, and I think there's always that break and that, I guess, feeling of disappointment in a way. I think from having my transplant, I appreciate life even more. I appreciate it already, but I'm appreciating it even more, and I'm appreciating this incredible gift, which I hadn't really called it a gift before because it's so cliched, but now I realise it's such a gift that someone out there, the person's anonymous to me, I wrote a letter to the family but haven't heard anything back, that some young person out there has died well before their time, and that I am now the lucky person who is getting to use the organs for a longer time. And as much as some people say, well, the person is still living in someone else, but obviously that person isn't living to the family, but I'm getting life out of that person still. One of the questions I get asked all the time is about my old kidneys and pancreas, and everyone is absolutely shocked to hear that now I have 3 kidneys and 2 pancreases, that they leave the old kidneys in. My advice to anyone else thinking about going on the transplant list or going for a transplant is to talk to as many people as possible, as many other transplant recipients, as many of the doctors and nurses. Ask every question, and they always say write your questions down before you walk into the doctor. Ask every question, no matter how silly it is, because I had researched as much as I could. I went and read about all the immunosuppressants, and all I did was get confused. So you learn so much more after the transplant. You suddenly understand all these things. But finding out from other transplant patients all the possibilities, so you're not going in there with unreal expectations, or that you're not going in there completely to be surprised by what's going to happen. Straight after my transplant, I was put on 3 different immunosuppressants, and one of them I obviously had some sort of reaction to it because it was making me vomit all the time, so they changed that medication from very early on. But the steroids, of course, that we're all on, one thing I've noticed is you get hairy. And maybe for guys it doesn't matter so much as a woman. It means you've got this hair problem, and that's one thing that I know whenever I talk to other female transplant recipients, we're always laughing about our hair issues. I think women need to realise that they might need to get waxed or shaved a lot more regularly than they used to.